Hi, everyone. My name is Dr. Eric Saunders, and I am an ophthalmologist practicing in New Jersey. So what is an ophthalmologist? I am a medical doctor, and I specialize in examining, diagnosing, and treating eye diseases. There are actually different types of eye professionals. I'm a medical doctor, an MD, ophthalmologist. There are also eye care professionals, optometrists. Instead of going to medical school, they go to an optometry school for 4 years, and they get an OD instead of an MD. They can also examine patients and do some things, treatments with eye diseases. They're not medical doctors, they're doctors of optometry. They also do eye exams. And then you have opticians that make glasses, and you also have ophthalmic technicians, and those are highly trained technicians that help the doctor get ready to see patients by doing certain tests, typing in certain pieces of information. But I am an ophthalmologist. Let's also talk about, so what does it mean when you're checking vision? So you've heard of perfect vision is 20/20. Actually, in reality, some people can see better than 20/20, but we'll say 20/20 is more of a normal perfect vision. So what does it mean when someone's 20/20, they have normal vision? Someone who has 2200 vision, it would sound like that's better, but that's actually a lot worse. The key is the bottom number, so 2200. Someone who is 2200 can read letters 20 feet away, whereas a person who is 20/20 can back up all the way to 200 feet and see the same letters. So someone who's 20/20 sees better than someone who is 2200, and that person sees better than someone who's 2400, and so on and so on. So that when someone says, what is your vision? And you say you're 20/20, that means you're essentially have normal eyesight. And then there are words like, what does it mean to be blind? We don't actually like to use the word blind. We like to say visually impaired. And there are different degrees of blindness. Completely blind means you can't even see light. Some people that are visually impaired can see light. Some can see movement. Some can read just the big letters on the eye chart. So there's different degrees of visual impairment. But generally, when someone says they're legally blind, it usually means they're worse than 2200.
Why do we sometimes blink without doing it on purpose? Like if a bright light is shined in your face?
That's an excellent question. Blinking in some senses is like breathing. It's like a reflex. It means it's something that you don't have to think about doing. It's a natural instinct to blink. You can control your blinking. If you think about it, you can blink several times, or you can force yourself to have a staring contest and not blink. But 99% of the time, you don't really think about it. Most humans blink about 12 to 15 times per minute, and obviously don't even think about it. One of many protective mechanisms for the eye is the eyelids. If you close the eyes, you have the skin and the eyelid, and that protects the eyes. Sometimes when there's a very bright light, we tend to do this and squint. It's sort of an instinct or reflex, the eyes close. Blinking also happens because if you don't blink, your eyes dry out. And so when you're blinking a few times a minute, you're making more tears to coat and protect the eye, and your lids are also blinking to clear out any mucus, any dirt, any debris from the tear film. It's to clean the eyes in a sense, and also to promote more tear film to cover and also protect the eye. But most of the time when we blink, we're not aware that we're blinking, and the brain just sort of makes us forget about it.
Is blinking the only way the eye is protected?
It's the most outer way to protect it, but there are actually several other ways that the eye can be protected. So if you've ever seen in any classrooms, there's a skeleton, right? So you can see the bony structure of the human body. So we have the skull, and you notice where the eyes are on the skeleton, there are sockets. They're not really holes, but they're sockets where the eyes used to be. And the orbits or the sockets are actually very protective. So if you were to get hit with a large ball or something in the face, that object, if it's big enough, will actually hit the bones around the eye instead of the eye. Most of the eye injuries we see are smaller than the size of the orbit, and they miss the bones. So the orbits protect the eyes. If something gets past that, there are actually protective layers of the eye. So the very outermost layer of protection is the cornea. You can't really see it. It's the clear layer on the center in front of the iris. That acts as a surface layer to protect against, smaller objects coming into the eye. The white outer layer of the eye to the sides and around the cornea is the sclera. And that's basically a very tough protective outer layer of the eye. It would take something pretty sharp to penetrate that. Once we get into the eye, to protect from too much light getting into the eye, we have the iris and the pupil. So the pupil, believe it or not, is not really a structure in the eye. It's actually a hole in the iris, the colored part of the eye. And the iris, the colored part of the eye, is actually a muscle. Actually has two muscles. One set of muscles constricts or makes the pupil smaller, and one set of muscles opens or dilates the pupil. And when there's too much light coming in, when it's too bright, the pupil actually gets smaller and constricts and limits the amount of light getting into the eye. So yet another way to protect from bright lights. And those are most of the protective mechanisms of the eye.
How come all light doesn't hurt our eyes?
Light is necessary to see. We only want enough light to be able to see. Sometimes if the light is too bright, as I said before, we will squinch our eyes so not too much light gets into the eye. The iris can change size to protect the eye from too much light coming in. So if it's this big and too much light comes in, it gets smaller and only allows enough light in to see.
What happens to the light once it is in your eye?
The way that we see is from light, and light is basically energy. It comes mainly from the sun. So the way we see is light energy bounces off of the objects around us and enters the eye. And these light energy signals are transformed into electrical signals and sent to the brain and processed. And it's during that processing system that we come up with images: people, flowers, tables, colors, black and white, different shapes. Light enters the eye through that structure I mentioned, the cornea. And the cornea is a protective layer, but it actually starts the process in helping the light to focus and get into the eye. Once the light goes through the cornea, it goes through that hole in the iris, the pupil, and it goes through the pupil into a structure that's behind the iris and the pupil called the lens of the eye. That is a structure that also helps to further focus the light rays into a point. The lens of the eye actually has muscles, ciliary muscles, that can change the shape of the lens to focus the light into the eye. Once the light is focused through the lens, it goes into the eye and hits the back of the eye, the inner layer of the eye called the retina. That's a very important layer of the eye. The retina is responsible for taking the light energy, converting it into electrical signals, and sending those light signals out the back of the eye through the optic nerve. The optic nerve sends the signals through the brain to the back part of the brain called the occipital lobe, and that's the area of the brain that interprets the signals. When the light rays go through the eye, the image that hits the retina is actually inverted, upside down, and backwards. Once the electrical signals go through the brain to the back of the brain essentially converts the image to a right side up image, and that's why we don't see things upside down.
So how come everything we see isn't just a bright light and we can see images?
Once the light is focused into the eye and hits the retinal layer, the light is absorbed by these special cells in the retina called photoreceptors. And there are two main kinds, rods and cones. Now, in humans, our most sharpest vision is from the cones. They give us our color vision. And humans are daytime creatures, so we have a lot of cones. We're able to see very sharp images, color images, and the cones function best during the daytime. We also have a set of cells called rods. These are more in the side of the retina, the peripheral retina, and they help us to see a little bit at nighttime. Both rods and cones take the light energy and transmit it to the optic nerve.
Why do some people need glasses?
I'm sure all of you know a lot of people who need glasses. So in the person that doesn't need glasses, the light rays that I was mentioning before, they focus in through the cornea, in through the lens of the eye, and a person that has perfect vision, the light rays will focus to a point perfectly on the retina. So if that happens, you don't need glasses. The light images are the perfect size and shape. They get processed, you have clear vision. So what happens when people can't see perfectly? People wear glasses to give the eye some extra help to focus that light image on the retina. There's different types of glasses. Some people wear glasses because their eye isn't a normal shape. They're farsighted or they're nearsighted. And then you have people over age 45 or so that need reading glasses. That's a condition called presbyopia, where the lens of the eye, remember I was saying before how it stretches and accommodates to change different focusing distances. As we get older, those muscles that stretch the lens become weaker and the lens becomes harder. So presbyopia is the condition where older people need glasses. Other people need glasses because they are either farsighted, we call that hyperopia, nearsighted or myopia, and then there's something called astigmatism. So a nearsighted person or someone who has myopia, they see well close up and they have blurred vision from far. A farsighted person we call hyperopic or hyperopia, and the opposite is the case for them. They can many times see well distance and not so much close up. Astigmatism is an eye that's a little bit oblong. It's a little bit shaped like a football, and so you have some light rays hitting the retina and some not. And basically, those glasses help light focus directly on the retina. So there are many reasons to need glasses. So one more thing I'd like to talk about, we mentioned mechanisms of our bodies, of our around and our eyes that protect the eyes. It's very important to protect your eyes when you're playing contact sports or sports where you could get hit in the eye accidentally by a person or a piece of equipment or the ball. So there are some very serious eye injuries that can result in serious damage to the eye, loss of eyesight, or blindness. So in a lot of the sports that we play in, it's very important to wear protective eyewear or goggles. And these take many forms, but they're basically clear glasses that aren't for seeing. They actually are wide enough that they cover the sockets and the eyeballs, and they're made of a special material that will not shatter if they are hit. Always wear protective eyewear when you're playing sports.